Hi, I'm Joe McClung.
And I'm Danny Syring.
We are with FloodGate Medical, one of the top talent firms in med device. We just got back from SAWC Spring in Phoenix, Arizona, and it was a great event. I mean, heck, there was even fireworks on opening night over the convention center.
Joe, those were for the Diamondbacks opening night at the stadium next door.
Come on, Danny. Don't let the facts get in the way of a good story. I always tell you that.
Fair enough. But still, there were plenty of explosive solutions on display that are proven to heal the estimated 2% of the population with chronic wounds and to capture their share of what is projected to be a $16 billion market by 2027.
Wow. You know, Danny, to really understand the trends in the market, you need to look at the market leader. In wound care, it's no different. Market leader Organogenesis showed its commitment to quality by highlighting their product Affinity as the only fresh amniotic membrane wound covering. Affinity retains native viable cells, and as a protective wound covering, it has been shown to help wounds move from stalled to closed in recently released clinical case studies. Additionally, they have combined this commitment to quality with a focus on education, hosting a CE lunch and a breakfast that it only had standing room only, actually, Danny. Their commitment to education extended beyond SAWC. They have trained their entire field team to be advanced wound care certified, providing their customers with a higher level of clinical support and understanding. And they went beyond and supported 200 Wound Hero scholarships to certify nurses in wound care.
Wow, Joe, it sounds like they're really supporting the market. One of the new wound healing therapies that intrigued me is an autologous solution called the 3C patch. It utilizes the patient's own blood through a 3-step process of centrifugation, coagulation, and compaction, creating a patch that can be applied and held in place, focalizing the healing. With the successful completion of a 269-patient multi-center RCT that shows the 3C patch is associated with significant enhancement of the healing of hard-to-heal foot ulcers and the newly announced national coverage determination, I expect to see an expanding adoption of this new autologous solution that seeks to engage patients in their own healing.
Wow. You know what? I do like emerging therapies. You know what I found really interesting? Was a company called ULURU, a new company that is bringing the UltraZeal product back to the market with tremendous success by focusing on the most challenging and hard to reach wounds in the acute care setting. At an educational event, clinician from Adventist Health shared an interesting byproduct of the use of UltraZeal, a significant reduction in pain score. They shared initial data that showed an 80% reduction in their pain score, with every patient in the data showing at least a 50% reduction in pain, allowing them to reduce and in many cases stop the use of opioid pain medication. A truly powerful result.
You know, Joe, with all these unique solutions used to heal DFUs, it's surprising that most patients simply walk out of the clinic with the same shoe they walked in with, which is why Dr. Jason Hanf created the Defender. It's one of the most unique offloading walkers ever created.
You know what? I spent 12 years selling aircasts, and this one is truly unique.
I know. It actually alleviates average contact pressure across the foot by up to 50% compared to other competitive products on the market. Combining this biomechanical advantage with the expertise of world-class designer Michael DeTullo, whose iconic work can be seen in the likes of Air Jordan, Converse, Brooks, the Defender is a protective solution that works, and more importantly, one that patients will use.
Yeah, that's important. I can't wait to see people have adoption of that level of protection for DFUs. You know what I think could be one of the most disruptive solutions from this year's SAWC? It's not even a healing, but more importantly, for the prevention of DFUs, which is estimated to cost the U.S. approximately $15 billion in treatment. The solution is the Orpyx SI insoles. These ultra-thin insoles can not only provide constant pressure data, but can also measure heat to be able to warn patients and clinicians about potential DFUs before they begin. In fact, a recent study demonstrated an 86% reduction in diabetic foot ulcer reoccurrence. They have created a simple-to-use product and an engaging app that will drive compliance for patients. This, combined with the abilities for physicians to reimburse through remote monitoring codes, will lead to rapid market adoption and a reduction in the occurrence of costly diabetic foot ulcers.
Wow, there really was a lot happening at this year's SAWC.
There really was. And I'm sure we missed something that was truly buzzworthy. If so, message us, comment below. Remember, if we can help you improve lives by uniting great people with great companies, we'd love to hear from you.